The Align Orthosis was designed in collaboration with a world-renowned spinal deformity surgeon with the goal of decreasing the incidence of proximal junctional kyphosis, a complication associated with adult spinal deformity procedures. The product can be fit to a wide range of anatomies, creating a controlled environment for healing. In this video, we will guide you through the step-by-step process of fitting the Align Orthosis to ensure optimal patient comfort and support. Practitioners can determine the correct size Align brace for their patient by taking a chest circumference measurement just under the armpits. Using this measurement, reference the sizing guide included in the instructions for use. Once the correct size brace is determined, measure the patient's waist and modify the belt of the brace to correspond with the patient's waist measurement. This is done by peeling away the folded over end of the belt, adjusting the length, and reattaching the hook and loop connection. Be sure to do this equally to each arm of the belt. When increased lateral trunk stability is required, the panels can be extended to the patient's midline. This is accomplished by lifting the securement latches on both sides of the anterior panel. Extend the lateral panels, as needed, to an equal distance on each side. These panels can be angled up or down to accommodate patient anatomy. Once appropriately sized, press the securement latches down onto the panels to lock in place. Apply the brace to the patient by wrapping the belt around the patient's waist and attaching on the anterior panel. Ensure the rigid frame of the brace goes under the patient's arms. Once the brace is secured around the patient, engage the compression mechanism by peeling the pull tabs away from the belt and pulling. When the appropriate level of compression is achieved, place the pull tabs back on the belt. Extend the sternal pad by lifting the locking mechanism and sliding the pad to the appropriate height before locking in place. The top of the pad should be about 2 fingers from the sternal notch. For tall patients or patients with long torsos, there is a second adjustment point that can be extended for the sternal pad to go higher. For shorter patients, the sternal pad extension bar can be removed. On the back of the brace, adjust the strut slide up or down. For optimal patient fit, position the posterior strap adjustment and frame in a comfortable angle for the patient. For shorter patients, the thoracic extension can be removed. For taller patients, the track of the strut slide can be extended to the top of the thoracic extension piece. The rigid frame attaches to the chest piece with a latch. The peg end of the latch can be rotated if necessary to clip into the chest piece. The angle of this peg can be fixed by tightening the screw within the peg. Adjust the width of the frame by sliding bars to accommodate patient's anatomy. The frame should be snug against the patient, but still comfortable. The width of the chest piece is secured by tightening the screw with a Phillips head screwdriver. Locate the horizontal straps found on the posterior aspect of the brace. Peel the ends away from the straps and simultaneously tighten both sides. The brace can be over-tightened initially. Then, instruct the patient to take a deep breath while allowing the straps to be adjusted appropriately. Have the patient take a second deep breath before placing the ends of the horizontal straps back down to engage hook and loop connection. Next, you will tighten the cross straps found on the posterior lateral aspect of the brace. These can be tightened one at a time to remove any slack. Check for proper fit by having the patient sit down. The sternal pad may need to be adjusted if it is no longer 2 fingers below the sternal notch. To remove the brace, place the pull tabs on the side of the brace. Unclip the latch attachment on the right side of the chest. On the same side, remove the belt from the anterior panel while holding the anterior strut in the opposite hand. To reapply the Align Orthosis, wrap the right arm of the brace around the body while stabilizing the front of the brace with the anterior strut. Once belt is connected, engage the chest latch. Lastly, compress the brace by pulling on the thumb tabs until desired level of compression is achieved. To clean the Align Orthosis pads, hand wash in cool water with mild soap. Rinse off any excess soap with clean water. Allow to fully air dry. For more information regarding the Align Orthosis, please visit aspenmp.com.